Alrighty, so my name is Laurie Bricker. I'm a dental hygienist. I've been in private practice for 28 years. And as Kathy said before, I'm doing some internship through their company here. I'm very grateful for that. And what I'm going to go over tonight with you guys is the clinical charting for your dental materials and all the importance of it. And some of it you're going to have, it's a combination. You're going to do paper charting, and then some of it we'll talk a little bit about who can do it like on the computer and how the computers are going to do it, because a lot of offices have modern technology. Can I ask who is already assisting or in the office? Are you guys brand new? Brand new? Are you guys working already?
We're working already.
Yes, but I was a dentist.
Oh, you're a dentist.
Yeah.
You're good. I'll be calling on you a lot. Okay, and you guys are already working a little bit?
Not in dental offices.
Okay.
Oh, as assistants.
Okay.
Francesca, right?
Mm-hmm.
Yeah, but she's not here yet.
Okay. Okay. Well, good. So we want to do this kind of interactive and make sure if you guys have any questions, we're going to start on the upper right, tooth number 1, and just work our way around. And if you have any questions, make sure you holler. And if you have any questions for Shelby, ask Shelby too. She'll be helping me kind of get through this. So you guys all have your paper chart in front of you with your the tooth, it looks like this on it.
It's a worksheet.
It's the worksheet. It
We
should.
don't have that.
It should
I mean, we
be-
have. Yeah.
Oh, like an old
You'll
worksheet?
want this worksheet to go through.
Yeah, what you guys have in front of you right now is your total
This one?
polishing.
This one I
Yeah,
have.
No, it looks a little
No?
different than
Okay.
that.
it looks like this. It looks like what's on the board.
Oops, sorry.
There you
Oh,
go.
this one?
Yes.
Okay.
There you go. The other one, that first one that you had was over here. Is that it right there, Shelby? No.
Let's see,
Looks like that.
I might go get some copies.
You want to get a copy? Okay, we'll get.
Packet? You wanna talk a little bit about like 116, 17?
Okay.
Just kind of the
Okay.
This one?
Shelby's gonna get a couple more. It looks like what's on the.
It's not in there.
So this one.
Yes, that can do it. There's it got the teeth number on it. Number 1, number 2.
1, 2, 3,
Yeah.
4.
That one will work right there.
Okay.
And we're gonna
This
start.
one.
Yeah, on the
So
top.
it is a spelling.
There. Yeah, this is it
Wait,
right
how
here.
do you, wait,
This
where
one
did you
here.
find that picture?
This one here.
Oh, I don't have that.
I honestly didn't even know I had it.
This one I, yeah, this one I have.
Oh,
So there you go. That's it. So while Shelby's getting those papers,
Oh yeah? Let me find it. I thought I had one.
we'll just kind of talk a little bit about the numbering.
No, I don't.
So the upper right is where everybody starts. It's tooth number 1. That's usually the wisdom tooth. As you go across from the upper right to the upper left, the midline is considered 8 and 9. Those are the people's front 2 teeth. And the upper left is number 17, which is their other wisdom tooth. And we're going to start on the top teeth once everybody gets their forms.
So this one's
Yes, that's it.
school papers.
I know, right?
I got him.
Are we drawing anything?
Yes, you're going to need a pen, and then we're going to go through tooth
Oh, there
by
you go.
tooth
Yep, I have it.
and do some different charting. Some of the teeth are going to be extractions, and we're going to go tooth by tooth. You're going to mark off the tooth on the top as far as what is recommended either for treatment or it's an existing restoration, and then down below you're going to write the tooth number and in longhand write out in words what you're going to do and then the initials. Your test is going to be on both of that, and you're going to do that down below on your paper. So go to tooth number 1 and see how it's got the line that goes, it's like an X from one side of the root down to the coronal part of it. That means that that tooth is going to get extracted. So underneath, you're going to draw the line through the top, and then underneath it in the blank spot, write tooth number 1, like the number 1, and it's going to be an extraction. And then there's a few different types of extractions that you can have. You can either have a routine extraction, or you can have a partial bony extraction if it's partly in the bone, or it can be a full bony extraction depending on what the dentist, usually the dentist will tell you what type of extraction. So down below it's gonna be the number 1 and then EXT for extraction.
She's doing it?
Oh, you don't have,
No.
Shelby doesn't have.
Like,
Start on that one. You'll be fine. It's the same.
So what line
This
are
one
we
too
drawing?
here.
That's where
And see how it goes? It's just the line from the top of the
So
tooth.
if ours already has lines there,
Yeah,
then we don't have to
that's-
do it.
That's what you're gonna write. Like if you were in the real world,
Oh,
you'd either draw
okay.
the line through that, and down below I want you to write out in longhand, EXT for extraction. It's gonna be the tooth number 1, EXT. And then if it's a routine extraction, if your doctor says it's routine, it's the letter R, and then you circle it. And if it's partially impacted,
yeah, I don't have.
it's PBI,
So routine is R
R
and then
and
circle.
circled.
Okay, and then what was the next one?
PBI is partially bony impacted, like some kids' teeth aren't in all the way, and so it's a little bit in the bone. And the dentist is going to tell you which it's going to be. So PBI, or if it's a full bony impaction, like if you were working for an oral surgeon, it would be FBI, full bony impaction. Did you get another sheet? Okay, good. And as you're talking to the dentist, you know, when he's calling out this, sometimes you're going to write it in freehand in the patient's chart, and then sometimes you're going to be typing on the computer, depending on what the office offers you. So for that. And then if we go to tooth number 2, see how it's colored in across the top, and then it's shaded on the front side of the tooth. That's the mesial. So that is a 2-surface filling, a mesial occlusal. Okay, see right there? And how it's easy to, I kind of keep track of if you need to know your surfaces of the teeth really well, like if it's a mesial or a distal. Always look at where the midline is of the mouth between 8 and 9. M is for the middle. And you can kind of draw a little cheat line right straight down through the middle of 8 and 9 and 24 and 25. And that will head you towards the right direction for mesial, to the middle of the mouth. And then number 2 would be it's an MO. So down below, write number 2, and then it's an MO. In some offices, if they use the white tooth colored fillings, they'll tell you what type of material to type in on the computer, or you're going to hand write out either amalgam or composite, depending on what the dentist tells you. And then if you go to tooth number 4, see how the shading is on the back side? So that is the distal, and then it goes across the biting surface. So underneath that, you'd write DO, distal occlusal. Are you guys pretty solid? You know your fronts and backs and tooth surfaces? A little bit. If that is going to be like major priority before you start working and before you take your test next week. Very important that you know your quadrants, where those teeth are, like if they call out number 4, DO, what surface and where that tooth is. Don't gamble that. for either testing or working in the office. It's really important that you know the teeth and where they're at.
R, you said only routine?
Uh-huh. Routine,
Mhm.
yeah.
Yeah.
Yeah, you're good.
M-O. Yeah.
How do you spell it?
M-E-S-I-A-L.
Bony impaction, yes, that's correct. Yeah, you're good. And the dentist, same thing, if you're working or whatever, you're gonna either dictate to or they're gonna tell you what is what. Yeah. So go to tooth number 6, which is the canine. Now we're heading towards the front, so you're gonna assume you're gonna use the white tooth colored fillings. And see how the coloring is across the front side, the mesial? And then it's also on the inside, so that's the tongue side or the lingual. Can you see where that is? And so the up, down below, you're gonna write tooth number 6 and write out mesial lingual. And those are the two surfaces. And you're gonna assume that it's gonna be a white tooth colored filling because they usually don't use silver and gold in the front.
Is there like a prefix for that? Is it like M-M? Or is it just mesial?
Mesial lingual is the long hand, and then the prefix would be, yeah, ML. And in some of the paper charts, if it's an amalgam, we just do the A with parentheses for amalgam, and if it's a composite, a C in parentheses, depending on how much electronics the office has. So then go to the midline on 8 and see how that filling goes right in between those teeth. It's just straight in the mesial right there, and that's your midline. So on tooth 8, you're going to write mesial, and then the prefix or the initials would just be M. And you're going to assume it's a white tooth colored filling. Same thing there.
It's M only, right? On it.
Yes, because there's no other surfaces, correct. See on number 9 how the line goes through the root, right up the midline right there. That's for a root canal that's existing already. So down below in your paper, you're going to write tooth number 9, and where you see that line, that's for root canal therapy, for treatment. So the initials are RCT, and longhand you're going to write root canal.
Where it is?
Number 9. Well, it didn't come through on yours. You're going to draw a line straight if it's existing like that. That's a root canal, RCT.
It has it
So
on her
yours-
paper, so just draw a line through it, and that'll be
Straight
indicative
through.
of a root canal.
Straight through the
Like
the root.
Yeah,
Like
all of it.
straight right up and down the
Mhm.
root. Yeah, you're not working on the
Like
enamel
that?
at all. Straight through it, just to the just on the root. Like that. Perfect. Let's see. Do you have anything? So
I
it's
have no idea.
right.
What was
Oh,
that?
sorry.
Sorry.
Just on the root.
It's gonna be
the line
RCT,
right from the top
And then
to
the
the
longhand is root canal therapy.
Yeah, and then down below.
Yeah,
RTT.
yeah.
but-
RCT.
Yeah,
You're-
and then
okay, good.
I'll transfer it.
Okay, because yeah, your test is going to be on all that. So yeah, RCT for number 9 for a root canal. Everybody got that?
Yes.
We good? So go to number 10 and see what surface is that one.
Mesial.
Yes,
Mhm.
it's on the mesial. So down below, right, number 10, mesial. And you're assuming again it's a composite because it's a front one. And you're going to draw that. Your line would be right there. So see on number 11. You're good. Hi. So see on number 11 how there's that circle at the end of the root right there? Your root canal now has an abscess. That's
This
your
one,
dot.
The point, the dot.
The dot.
Yeah, I don't think ours has it yet, so can we just make sure we're getting all this?
Yes. So draw a circle at the end, and you'll see it like on your x-ray. It's a big black dot like an exclamation point. You'll see it, it's black.
Mhm.
So at the top, like that right there, draw a circle on the end of your root tip, and that's an abscess.
Yeah. And then the bridge isn't going to be on there later either.
Uh-huh.
It shows it on the PowerPoint too, guys.
Yeah, see on the PowerPoint right here? ABS.
Oh, okay. Alright.
You got yours?
ABS is the short form?
Abscess.
Mm-hmm. Yeah.
Abscess. And so, yeah, you wrote it down.
Okay, somebody done it right.
Yes.
Oh, it's like that.
Yep.
Oh, okay.
So we good?
ABSCESS.
Well, okay. I'm just gonna do it here. Wait, what?
AB. SCESS. CESS.
I forgot to see.
Short form is ABS.
Well, ABC.
So we all got this, because you need to know the spelling for your final two.
Mhm.
Spelling and initials and tooth number.
So our finals next week.
Yes, Wednesday.
Just the test for this is next.
Oh,
Okay.
It's this and the histology.
you really got me going there. I was about to freak out.
It's the preclinical exam and the histology spelling exam
Yeah.
as well.
And in real life on the computer, you just hit the button and it'll pop up automatically.
Mm.
So are we ready for 12?
Yes.
Okay, see how it's outlined on the chart right here? I want you to draw in that outline. It does not fill in the shade, but it's just outlined. That is for a veneer. So you're gonna write on there number 12, and then on the lingual surface, see how it's like hashtagged right there, hashed in? That's on the other surface. So the outside is clear. It's V for veneer, and then write it out. VENEER. So do you guys know when it's solid like this, what that one means? Have you guys seen that before in your clinical charting? See how it's solid all the way around? Any guesses?
No.
Yes.
Mm-hmm.
And then what kind of crowns can we have? You can have porcelain crowns,
And metal
porcelain fused to metal, and gold. So there's 3 choices for you to have that you're going to write on your test. So for number 14, you can have it's called ceramic. So it would be a CC for ceramic crown. And then you can have a porcelain fused to metal, PFM. And then you can have gold, and that's FGC, full gold crown. And same thing on your computer. You know, if it's digital, you can type in what type of crown and ask the doctor. If you don't know what it is, say what kind of material you're going to use, because it'll make a difference on the coding for your insurance.
Mm.
And the patients will want to know what's going to go in there. We got it on that one? 3 choices. Porcelain fused to metal.
What was that?
Porcelain fused to metal. You know how you see like a porcelain crown and some people have like silver down at their gum line? That's the porcelain fused to metal. And people don't usually want those on their front teeth because they don't want the silver rings on their front teeth. PORC. ELAIN? AIN. It is. PORC. Okay, so go to number 16, that charming wisdom tooth on the upper left. That one's got a solid X through that one. See how that's X'd on the thing right there? That one's already missing. So you're running an X through it, means it's not present. And down below, you can either write missing or the initial M for missing. Lowercase? Lowercase.
Yeah, because I was gonna say mesial's uppercase, right?
Lowercase m.
Lowercase m for missing. And the computer is probably just going to mark an X through it. There usually isn't a word written with that. So that's on the upper left. Now if we go to the patient's lower left, that one is also missing. That's a wisdom tooth on the lower left. So run an X through that one, lowercase m. Cross it off.
And go over how like 18 would be like a virgin tooth.
Okay. So see how 18 is just empty? There's nothing on it. That tooth has had no restorative, and there are some dentists that will call it like a virgin tooth. It's had no treatment. If there was a sealant on it, sometimes you can write an S. If the kids come in, like if you work in a pedo office, you would write an S. It's not on this diagram, but it can be on others. We have a pedo office, so we have lots of S's. So go to 19. Does anybody want to make a guess at what this one is? What's that surface right there on that one? Yes. And what are the options for fillings on that one?
Amalgam.
What's the other one?
GIC.
Which one?
GIC? Glass ionomer?
Yes.
Hmm.
A composite.
Composite
Mhm.
glass.
Mm-hmm.
I didn't hear that.
So a glass ionomer is like a white. It can be a white tooth colored material, a composite, and that's on 19. It's an occlusal. So it would just be a straight O for occlusal, and then write out occlusal. And then go to 20, the bicuspid down there. See how there's two fillings on that one? It shows just the front side of that bicuspid and then the back side. That's a mesial distal filling. It does not show across the top. So probably when that tooth maybe was by itself, the dentist could direct access that one tooth, but they didn't have to cut the top. It's just the front and the sides.
It's like an almost finished crown proof.
So would the previous be MDF, mesial distal filling? Or how would that be?
At just MD. Because you know it's a filling. The only variable that we don't know is it a composite or amalgam. Generally, it's going to be a composite because it's in the smile zone. Some patients in the old days might have had amalgams.
So then do we need to write out composite or amalgam? Like, do we need to know that for the test?
Is that on the test?
Not really. Not really.
No,
but
just
in
know
charting,
the surfaces of what would be. In the clinical, yeah, you'd want to know because if the front office lady came back and asked you, what are we going to do for this patient's treatment? What are you going to tell the front office manager? It's going to be a white tooth colored filling, I would assume. So yeah, and if you don't know, ask the dentist. You know, if you don't hear him, sometimes I can't hear my doctor. His back is to me and I can't hear. So I'm like, okay, tell me that again. There's no dumb questions. Ask the doctor what he wants to do. So if you go to 21, see how there's the line up and over the top?
they don't have that on their paper, so they're gonna have to draw it.
Which? Oh, it's gonna be 21, 22, and 23. See how it goes up and over and
So
kind of
page
21, 22, and 23, and then go down. That is a bridge. And did you get? Yes, that's a good one. Good. Yes. You got it to 24. Just goes to 23. Yeah, see how it ends right here? 24 is not in it. There you go. You got it?
Yeah, why not?
You got it? So on that
I
one,
don't think so.
does anybody know what the big tooth is called? It's called a pontic, or as people in the chair say, it's the fake tooth. And so 23 is considered your pontic. So write out pontic for 23.
Would it be 22 since it has a P in it? Or no?
Yeah.
Not 23. Oh, theirs is different than mine.
Okay, this one, yeah, you're right on this one. So 22 is the P, sorry. And then the two teeth that are present, those are abutments.
22 is
Pontic.
I saw that.
C-O-N-T-I-C.
What would 21 and 23 be called?
Abutment.
How do you spell that?
A-B-M-U-N-T.
A-B-U-T-M-E-N-T.
A-B-U-T-M-E-N-T. Thank you. A-B-T.
Like the abbreviation.
And the abbreviation is A-B-T.
Wait, ABT.
For
It's
the
A-B-U-T-M-E-N-T. Abutment.
Would the abbreviation for the project just be P?
Mm-hmm.
yes.
So do you guys understand what a bridge is and how it works?
So the two teeth on the side, what is considered the abutment, those teeth are present in the mouth, okay? And the space where the patient's missing the tooth is the P. That tooth is gone. So when you make a bridge, it's actually three parts. The real tooth, the missing tooth, and the real tooth here. And when it comes back from the lab, it's actually three pieces. It looks like three little teeth wedged together.
It's all
And-
attached.
And it's all one unit, and they set it on the two abutments, and then the fake tooth just sits right in the middle, just literally like a bridge. And once it's cemented, then you need to show the patient how you're gonna clean underneath it, cause they have to take floss and take a threader and clean underneath that. Cause they need to keep the two good teeth clean so that they don't get decay. Because if decay gets on either of the two abutments, you gotta cut the whole thing off and start over again. So they need to keep the existing abutments clean.
So the abutments that count.
Yes.
Yeah, It's
Mhm.
like two crowns that go
Two-
over.
Yes, two crowns.
Is hold on, contact. Yeah. That's an example.
So that's considered, like if you were gonna tell the front office lady, that's a 3-unit bridge.
And there are
And
like
there's different codes for your abutment tooth, your pontic tooth, and then your other abutment tooth.
there can be like 4-unit bridges, 5, 6
Yeah,
unit bridges. They can
Depending
be-
on what they're, and
pretty
the
big.
longer the span, the harder it is for the patient. You know, that's a lot of stress to keep clean.
Mm.
So do we all understand the abutment, pontic, how to clean it? Which is the fake tooth, which is called a what? Pontic.
Mhm.
And what's the two real teeth called?
Nice.
We got it? So go to 24, and that tooth has a little filling on which surface? See where it's right there at the, yes, right there at the midline. That's a mesial. So you're gonna write down tooth 24, mesial.
Do you guys understand what makes it mesial?
See-
According to the survey.
Yes.
Yeah. Yeah, so if it's the surface closest to the midline.
See where between 8 and 9 and 24 and 25, whatever is facing in that direction is mesial. Mesial or middle, depends how your phrase you want to remember it. The technical word is mesial. But yeah, make sure you always get the mesial, the midline right there where the patient smiles. So go to 27. Let's see, she's got, I don't, what's this chicken scratch right here? That's nothing. Go to 27. It's got, see how it's got the line through it? Down on the root? What is that? Yes. So write down tooth number 27. Start with your root canal.
Would it be RCT?
Yes, good. And then make sure you know how to write it out also, longhand. And that's in the root, so there's two parts to that answer. See how there's the root canal? And then there's also a filling on the top part of the tooth?
Distal.
Yes, see how it's opposite? There it is on the distal. So that's going to be, and it's also, see where it's at on the lingual, the other part of the chart, on the inside?
Partial denture or
No, it's just a filling.
filling?
Just a
lingual?
fill, distal lingual filling. DL.
Yeah.
And that's the hard part. you gotta look at the little teeth on the inside, see up here to make sure nothing's marked on the inside. Don't forget those. Cause you always get the ones on the big surfaces. Don't forget the little, that's the linguals, tongue side.
And maybe you want to like explain why that probably wouldn't happen in real life.
Cause it needs a crown.
Mm-hmm.
She said last week she wasn't gonna come today.
So going back to this tooth that's got the filling in it, on this chart it shows as a filling, but in real life it probably would have a crown on it because once you take out the nerve of the tooth becomes brittle. And so most doctors will have a crown on top of that tooth so the tooth doesn't break in real life. So here it shows as a filling in a root canal, but later on it could be modified and updated to show a root canal and a crown.
Probably would too.
Okay, so go,
So if there is only crown, it will show how.
if it was going to be a crown, it would show there's your root canal and filled in like a crown.
Or this body.
Mm-hmm.
That if they change the treatment, it would
Oh,
be
okay.
here and here. Because that isn't a strong way to protect a tooth with just the filling, because that tooth will be brittle. And those little bicuspids shear off, you'll get a cusp that'll break off. So eventually a doctor would probably go to a crown. Does everybody get that part of it? See how on 28, what do we call 28 when there's nothing going on?
Anybody?
Anybody? There you go. No treatment. And then what do we get when we go to 29? See what's the surfaces on that tooth?
Basial distal occlusion.
Yes.
MOD.
Yes. You see how in the middle there's a little dot? And some offices will draw it all the way across the top of that occlusion, and some just draw a dot depending on how much creativity the assistants have or whoever's charting. Sometimes they just color it all in.
She said.
I know I do a little hourglass shape.
Yeah, color it in. And on the computer fills it in for you. So 30 is a little deceiving.
Mm-hmm.
See how it's just barely dark down there right at the gum line where the coronal part starts on the root? See that line that goes left and right? That's a buccal filling. And some people also call it a class 5 filling. And it's considered just on the cheek side. And then you want to say where it is. And so it would be on the facial or the buccal surface. It's on the cheek side. If it was on the tongue side, it would be lingual. Usually you don't see them on the tongue side, but you want to clarify where it's at in the mouth.
So short form will be B only.
Mhm.
B.
And F for facial.
Yeah.
So B, F. And those are like where patients have recession, and they'll put like a little tooth colored filling down there to protect that root structure.
Mm-hmm. What happens if you brush too hard with a coarse toothbrush? It kind of wears away at that area.
And that'll ditch out. You see that on a lot of older patients that have scrubbed their teeth over the years, as they call it, and then that filling helps protect that root. Or if they have a lot of sensitivity, that filling, they can bond that right to that gum line down there. It's white, they can't see it, and it protects that surface for hot and cold sensitivity.
Because it starts to expose your cementum.
So for recession you're putting R.
The recession's not on this. You would put that would go on the tissue charting. It would be you would put recession is for the tissue, but you would for the filling it's a class 5, so it's a buccal. Yeah, two structures, a different chart, and it's gonna be a different chart, paper chart, and a different chart, digital. Mhm. So number 31, again, what do we got there? Nothing going on. What's that one called? Virgin tooth. And then, so you're gonna put number 31, and you can just put virgin on it. And then the last,
We can put V
B.
for version because V is for
Or spell it
veneer.
out.
Oh, you wouldn't put V.
V is for veneer.
Yeah, you wouldn't really chart anything.
have to
You just
spell it
wouldn't
out.
put anything down. But I think she's talking about like the bottom where you're listing what they are. You could say that it's a virgin tooth down below, but you wouldn't draw a line and put any abbreviation for virgin tooth. There's just, you just don't mark it.
Nothing, just leave it. Leave it blank. And then one more wisdom tooth, same as on the top. See how there's a single line? Yep. It's for an extraction. And it's down as a routine one. So then you put the R with your circle. And the dentist, same thing again. The dentist is going to tell you what type of extraction that you're going to put on there.
R with a circle, what?
For routine. Routine
Oh,
extraction.
What's number 1 covered as a routine too?
It can be either routine, full bony, or partial bony. So there's 3 ways depending on what the doctor calls out. And if a patient comes in and they can hand you their teeth in the cup, then they're going to have a full, like if it's on the top, if you cross out all the top teeth, it would be a full upper denture. And if you cross out the bottom, it's a full lower denture. And those initials would be FUD for full upper denture and FLD for full lower denture. And same thing, you'll see patients come in that might have a full upper denture and a few teeth on the bottom, and they give you the teeth to clean what they can, and you clean the rest, or the dentist does. So you always have to ask how everything's feeling. And the only other one that I saw, and I don't know, I saw it online, implants, is the corkscrew. Are they tested on that? No? Okay. Any other questions? Do we have everything copied down there? Okay. So make sure everybody knows for your test, and even like when you're working on patients, know your midlines and know your teeth numbers so that if they call out you need to polish number 12 again, you know which number 12 is.
Do you want about like how there's a buckle and then facial, but it's kind of the same area.
Okay.
But just like has to do with
The shape of the
portion
teeth.
mouth.
So on the mouth, where the molars are, you know how they're further back in your cheeks? That is considered on a lot of the charting to be buccal because the cheeks are adjacent to it. And then as the patient smiles and the tissue hits towards the front, where the lip line is, those are considered the facial. What do you test on 6 through 11 is facial?
Yeah, so
So 6 through 11 and 22 to 27 would be considered facial, right?
yeah, the outer portion of the tooth
yes.
that's like facing the lips.
Anything facing the outside and the cheeks and the lips.
And then same with like lingual and palatal.
And
6
the
through 11 and
6 through 11 and 22 to 27
known as exterior.
is anterior facial. Usually those are where people the smile. And then buccal is the molars and the bicuspids that face the cheeks. And lingual is the ones that face the tongue.
And then like palatal up top.
And they're going to differentiate on the top teeth. It's considered palatal. And again, on the bottom where the tongue is, it's lingual. Some of it's common sense, you know, see where the tooth faces. Does it face the palatal? Does it face the cheeks? Or does it face the lips in the front? Is it facial?
Mm.
And then where your midline is, and then your four corner wisdom teeth.
And then also there's like incisal as opposed to occlusal.
Okay. And on your charting, remember how some of them went like MOD? O is the occlusal, so that's the biting surface on your molars, and incisal is the edges of the teeth across the front. 7, 8, 9, and 10, and 23, 24, 25. All those little edges, because those teeth don't hit, those are considered incisal.
Incisal is the edges.
Uh-huh. And then occlusal is where the molars and the bicuspids hit on the back.
And then do you guys know which teeth the midline goes through to separate the 4 quadrants?
There we go. So right there in the middle. So we have occlusal, incisal, facial, lingual, and buccal. Can you find everything on that? Those surfaces? Hi. So we know where all those surfaces are. Do we have any questions? Are we done yet? Candy? Anything else we should go over? It's on the test?
If patient comes that she have an implant problem in implants, so we will write I for implants.
Uh-huh. And on the computer, you're not tested on it, but it shows as like a corkscrew going through the root. You know how like a root canal shows a straight line, an implant shows as a corkscrew on the computer. It's not on the test, but it shows as that on the computer for an implant. And then you'd have the same thing. You'll have your implant and then your crown. You have to pick what color or what the crown is that's going to go on top of that. And that would go on the charting also. So yeah, it's 2 point, but the computer helps pick a lot of that too. Did I get everything?
Yeah, but
Anybody
I'm
got
gonna
any-
step in and just do 1 or 2 little things just to make some clarity, some clarity on just a couple little things. You did a fabulous job.